Hey, Mr. J. I'm John, and this is going to be the special tests video for the wrist. This is Kason. He's one of my teammates. So, for the duration of this video, do I have consent to touch you?
I give consent.
Awesome. For the duration of this video, all tests would usually be done bilaterally, but for the sake of time, we're going to be doing just the tests unilaterally. So we're going to start with the Fallon's test. This is going to be for carpal tunnel syndrome. So I'm going to be standing in front of the patient. I'm going to take his arm and then passively move his wrist down and apply overpressure during passive wrist flexion for 1 minute. And then obviously I'm not going to do it for 1 minute, but here obviously positive tests would be tingling develops or an increase in the distribution of the median nerve. Alright, so this is going to be the Allen's test for blood circulation in the hand. So I'm going to ask Kason here to rapidly open and close his hand and then clench it shut. So can you do that? Just a second. I'll clench it shut. And I'm going to put both my thumbs on the radial and the ulnar artery. I'm going to hold them there. And then I'm going to ask him to open his hands. And then I'm going to take my thumb off the radial artery. And blood flows back into the hand. And then I'm going to let him relax a little bit. Then I'm asking him to open and close his hand rapidly again. And then clench it. And then I'm going to, once again, put my thumbs on the radial and the ulnar artery. And this time I'm going to ask him to open his hand. And I'm going to release the ulnar artery. And then blood flows back into the hand. It's hard to see because of the light. This test determines the patency of the ulnar and radial arteries. And with a healthy artery, the blood should stream back into the hand quickly. The next special test is going to be the Finkelstein test for de Quervain syndrome. So the patient's going to be seated, and I'm going to be standing in front of the patient, and I'm going to ask the patient to put his thumb and tuck it under his fingers and make a fist, and just hold it. And then increased pain in this area of the radiostylar process and along the length of the extensor pollicis brevis and abductor pollicis longus tendons would be a positive test. Alright, so for the Finkelstein test of the wrist, I'm going to be standing in front of the patient. I'm going to take his wrist and I'm going to tap over the carpal tunnel of the wrist. Let's see if you can see. And then, so the median nerve runs through the carpal tunnel up to the index finger. So I'm going to tap from the top of the index finger down through the carpal tunnel all the way up to the elbow. And a positive sign for carpal tunnel syndrome would be tingling either in the thumb, index finger, middle finger, and lateral third half of the ring finger. Alright, so the last special test is going to be the Watson test for scapholunate instability. So I'm going to be in front of the patient. My patient is going to be seated with the elbow flexed and supported on a table and the forearm and the hand positioned up. So this, so elbow supported, and then I'm going to stabilize the wrist right below it, and then I'm going to be moving my patient's wrist into ulnar and radial deviation, like so. See? And then a positive test would be reproduction of pain and a notable pop at the scapholunate articulation.